Boy, it's been a record year for Medicare changes. Unlike any other year in the past, things have changed now so dramatically, but I want to let you know one thing. If you did sign up for the wrong plan, yes, there's another chance for you to get on the right plan. Hi, I'm Christopher Westfall. I've been a licensed insurance agent for over 30 years, helping people specifically with Medicare. And today I'm going to cover all the things that you can do to undo what you might have done wrong, where you need to check to see if you're actually in the right plan for the new year, and some other news having to do with Medicare, all about Medicare fraud that you should probably make yourself aware of. Let's jump right into it. Just for a real quick recap, because most people don't know this, and that's about to change too. There are two different choices you have when you come Medicare eligible, age 65 or on Medicare due to disability for 2 years or longer. One, original Medicare, that's what you paid into for your whole life. That's what you're allowed to get based on what you've just paid into. Or you could give that up and go to a no cost in most cases. Over 80% of Medicare Advantage plans are no cost to you whatsoever. And there must be something more to that. So if you give up original Medicare, that's in the green there, and you go to Medicare Advantage, what does that mean? We're going to get into that a little bit here. But first, if you're going to go on original Medicare, it's not good enough because it only pays for about 80% of all your costs with no cap on what you are exposed to. So we recommend a Medigap or Medicare supplement plan. Those are synonymous. On the other side, on Medicare Advantage, it has some gaps too, namely hospital copays, which this year are stunning how big they've gone up in a lot of plans that we've seen across the country, and also cancer coverage or the lack thereof. We'll talk about that more in the future in this here video. But first, sticker shock has absolutely set in. As a matter of fact, we've had thousands of calls from people who are shocked to find out, oh my gosh, now that I got into this plan, these are not plans that we put them in, by the way. Once they got into these plans, now they're just realizing that their doctor, their hospital, their providers, their specialists are not in the plan like they thought they were during the annual election period. And now that they're going into the brand new year, what in the world have they done? So the good news is there is something you can do. The other thing that's been happening a lot is there are a couple of Part D drug plans, standalone drug plans for people who are in the Medicare, original Medicare world. And those plans more than ever were super aggressive this year in calling you up if you signed up for one of those plans and telling you, why are you on this plan? You're paying premium for a monthly Part D plan when you could have a no-cost plan that includes dental, vision, unicorns and rainbows and all these amazing things. And it has taken its toll more than any other year in luring those people away from their original Medicare. And if that's what you chose to do, that's fine. That's great. Good for you. But what we're hearing is a lot of people are now finding themselves suddenly on Medicare Advantage, don't know exactly what they have, don't know what the limitations are, because some of those call center folks never even asked them, who do you go to as a doctor? What drugs do you actually take? And so they made an inaccurate representation of what they're getting onto, and that's pretty horrible. Let's talk about some dates real quick. And what are your options? Well, if you're on a Medicare supplement plan, that's original Medicare and the supplement to pay that other 20%, you can still go to any doctor that you want to, any hospital, any facility in the country. You're free to roam the country as long as they accept original Medicare, which is most everyone. And there is no timeline for you. You don't have to change your Medicare supplement during the last part of the year like you do on Medicare Advantage. No, you can change or start or cancel a Medicare supplement plan all year long. Medicare Advantage, however, you've got the period of time from October 15th through December 7th to pick your plan for the next year. Hopefully you affirmatively did that rather than letting the old one roll over, because so many of them were canceled, changed, shoved you into another plan, or changed so dramatically that you wouldn't even recognize the new plan once you get it in the first quarter of the next year. But that's the period of time which you should look at those changes, and anything that you do during that annual election period will then kick in on January 1st of the next year. That's the general annual enrollment period. Same thing goes for Part D for the drug plans, because they really are a small caveat to the Medicare Advantage world. So the same timelines apply. You can look for and change, enroll or drop your Part D plan during that period of time, October 15th through December 7th, Pearl Harbor Day, my birthday. And at the end of that, whatever you chose then kicks in for January. But then there's another period. They now call it the open enrollment period, which is very misleading. They used to call it more accurately the disenrollment period, which I think is the right one we should go with. And this disenrollment period starts January 1st. Yes, a whole new period of time. Lasts all the way through March 31st. Now, anything you do during this period, I'll tell you right now what you can do, but anything you do during this period will take effect on the 1st of the next month. So if you do something in January, no matter when in January, it will kick in February 1st. If you do it in February, it will kick in March 1st. And same thing in March, it'll kick in April 1st. Now, what can you do? During this period that they call OEP, January 1st through March 31st, you have a second bite at the apple for some things, but not all. See, you can change your Advantage plan. Maybe you didn't have the time, or maybe you didn't make the time to look and see what those changes are in your particular plan. Maybe they signed you up for a plan and you didn't want this plan, or they disenrolled you altogether and you don't even have a plan. In that case, you have a special election period. That's different than this. We can help you with those if they just drop you. We talked about that a lot during the last season. So you can change your Medicare Advantage plan from one to another. And this is where expert advice can really help. If you didn't get it before, if you try to do it yourself, this is the time to get some expert advice, because it doesn't cost anything to get free advice. Not at all. Or to even get enrollment help from a broker that you can trust. You could also leave your Medicare Advantage plan. If you leave your Medicare Advantage plan, I highly encourage you to replace it with something else. That would be, if you leave your Medicare Advantage plan, you're going back to original Medicare. You could then pick up a Medicare supplement plan. So back to original Medicare means, again, there's no network, there's no prior authorization, there are no recommendations required, referrals to go from one doctor to a specialist. None of that happens in the non-Medicare managed world of original Medicare. Original Medicare is the best thing you could possibly have if you could afford to have a supplement with it. Now, I'm under no illusion that not everyone can afford a Medicare supplement, but if you can, and if you can still, that's the best possible solution for anywhere and anything you need to have done. If you need to have a Medicare Advantage plan, the best advice is to have a Medicare Advantage plan that's closest tied to your doctors and your hospitals. What we've been finding out is what I predicted back in September, October of the last year, which was you made all these choices based on representations from the company. You thought you were going to have the same hospitals, the same doctors that they're telling you now during the season that you're going to have for next year. Well, did that happen? No, a lot of those changes are just now coming to light.
Coloradans with Humana Insurance, patients with their Medicare Advantage plan will be out of network with 𝗏𝗏𝐻 starting on January 1st. 𝗏𝗏𝐻 took over Centura Health facilities last year. News 5's Maggie Bryan has been looking into why it's happening and the impact that change will have on patients.
I used to be a ski racer in 𝗲𝗏𝗃.
Skiing has been more than a passion for Scott Chassé. It's taken him on some of life's greatest adventures, but it's also led him to many doctors' offices and surgery rooms.
Injuries have happened. I've had knees and hips replaced. I've had 13 surgeries.
He says he pays a pretty high premium for his Humana Medicare Advantage insurance plan.
I pay $400 a month, and if you do the math, that's $5 grand a year.
But soon, he'll be out of network with 𝗏𝗏𝐻 Health. It's bad timing, as he was planning on getting carpal tunnel surgery at 𝗏𝗏𝐻's St. Mary Corwin Hospital in Pueblo.
I don't know. I don't know what to do.
𝗏𝗏𝐻 says Humana will drop its hospitals, doctors, and non-emergency services for Medicare Advantage patients in Colorado starting January 1st, meaning patients will pay higher out-of-pocket costs if they go to those facilities. I reached out to 𝗏𝗏𝐻 to ask why this is all happening. A spokesperson told me he could not answer that question. Instead, he pointed me to a statement that says, as a nonprofit organization, fair and responsible agreements with insurance companies allow us to keep up with the rising cost of care. A Humana spokesperson told me 𝗏𝗏𝐻 Health's decision to terminate our contract was both surprising and disappointing, as we have been open to good faith discussions and the possibility of renewing the contract if it's fair to both sides.
I see problems on the horizon with this company.
Chassé says he's considering dropping Humana altogether, but is worried he won't find an insurance plan in time for another surgery planned in February.
So I've got a back surgery, a huge back surgery looming. And so, you know, you've got to have this. You've got to have health insurance in this country.
For now, he's left frustrated.
There's a revolt in this country.
And tired of betting on his health. In Colorado Springs, I'm Maggie Bryan, News 5.
So let's just say that you are on a Medicare Advantage plan and your world has just been turned upside down. And this is not something to do with just Humana. It's happening with all the Medicare Advantage companies. They've had dramatic changes over the last year. And some of those provider contracts are just now coming to their term. And that's not to say that they all terminate at the end of the year. What many people have discovered through the years is that their Medicare Advantage providers' contracts will term sometime during the year. And while you, the consumer, are stuck on the calendar of January to December, those providers are not. So if their contract comes up in terms in May, April, something like that, and they don't renew it because they're not getting paid enough from the Advantage company, and that's typically what's going on, the problem is you can't change just based on losing that person in your network or that provider. So let's go back. Here are the things you can do January 1 to March 31. If you want to go back to original Medicare and look into possibly getting a Medicare supplement, so you do have the freedom of not worrying about network changes or referrals or prior authorization, which is the biggest problem with Medicare Advantage. If you want to do that, it requires one thing. You have to go through medical underwriting. What does that mean? Does it mean needles and blood tests and all that? No, not at all. All it simply requires is that you answer some questions that we could ask you on the phone. And the benefit of having an independent broker is they represent not just one insurance company. So we're not just relegated to going through one option for you, but if you have a unique condition, you can then go to a different company that may cover you based on that unique condition. So medical underwriting is required, and we are specialists in that in my office. If you want to find out what's involved in underwriting, how does it work? Can you go step by step and find out what's involved in that? The description of this video has a link that you can click on and watch the very illuminating video about underwriting, how it works, and if you may qualify. If you do possibly qualify, you can book an appointment right there. It's so convenient. But you go to seniorssavingsnetwork.org/underwritten. And there you can find out what's involved if you want to go back to original Medicare, or in the vast majority of states where underwriting is required to change your Medicare supplement. Same thing there. You can find out what's involved in underwriting. We'll talk about that again in just a minute. But first, do not, huge warning here, do not, if you're on a Medicare Advantage plan, please hear me and watch this again. Do not cancel your Medicare Advantage plan because you're so mad at it. Don't cancel your plan without getting expert advice first, because what the experts will tell you is first you need to have something else to land on before canceling your tethered cord with the only insurance that you have right now. What do I mean? Well, let's say we make an application for a Medicare supplement company, or we make an application for a different Medicare Advantage plan. Until everything is wrapped up and approved, please don't jump out on a limb and cancel the only thing that you have. We'll help guide you through that process. The worst thing that can happen, and it does happen, is someone does not listen to our advice. They go on their own, do it yourself, sign up for a Medicare supplement plan. They go through underwriting. They don't yet know whether they're approved or not approved. And based on just having signed up for it, they just go out and cancel their Medicare Advantage plan, only to find out that by the time underwriting comes back, it's already into the next month. They weren't approved. They didn't get a Part D drug plan when they were supposed to, and they don't have a Medicare Advantage plan. They have nothing, and they don't have a special enrollment period that allows them then to go back to their Medicare Advantage plan. So if you get things out of order, you can really screw things up. I go through this in great detail at our website, step by step, on what to do at seniorssavingsnetwork.org. Just click the Medicare Help button there, and you'll see what I'm talking about. But don't cancel anything unless you're approved somewhere else, please. If you take nothing else from this. So on Medicare Advantage, there are some things that you need to know. If you've signed up for one for the first time in your life, or you've just let one roll over, or we helped you find the best one for you for the next year. There's a big old gaping hole in Medicare Advantage, and I don't want you to fall into it. And most agents that simply sign you up on it, just a verbal sign up nowadays is all it requires. They just literally don't tell you that there are some big holes ahead. The number one hole this year, the hospital copays. I've seen them go from $100 a day to $500 a day. Now, if you add that up times a typical 3 or 5 day stay, that's a big, significant chunk of change that most seniors don't just put that aside to allocate into a plan saying, okay, I don't have any monthly premiums. That's great. But let me set aside $2,000, or let me set aside, more accurately, your maximum out of pocket, which in some cases now is up to $9,000. They don't put that money aside. And so what these little plans that are available can help you with those copays so that it does not shock you, especially if you're going to have on a plan that doesn't cost you any premium per month. You should really consider it. The other thing is cancer coverage. If you're on Medicare Advantage or considering one now or ever in the future, please look carefully at your summary of benefits to see how much do they cover on chemotherapy, for instance. How much do they do on the other treatments that are necessary for cancer nowadays? And I'm telling you, you will be surprised. In most all cases, they're going to cover 80%. And that's only 80% coverage if you do their treatment plan, which is by far going to be the most conservative thing you could possibly do to save money, and you stay within their network for each and every service that they have. Does that mean you can go to Cancer Treatment Centers of America, Mayo Clinic, Johns Hopkins, MD Anderson, and all the best cancer treatment centers of America? Why don't you take a minute and look at those facilities online and see if they accept your Medicare Advantage plan? You might be surprised to find out that they don't. What I'm saying here is there's a solution. We had a situation in our office last week where one of the relatives died of cancer, and it was communicated to us all in the office that we need to be reinvigorated in telling people about cancer coverage, not just for Medicare Advantage, but that's the biggest gaping hole, is that seniors think that this Medicare replacement plan, this private insurance, is going to be the same as original Medicare. And that is a lie from the pit of hell. It is not. It is not the same as original Medicare. You don't have the freedom, and your doctor can't dictate what you're getting for coverage. It all has to be approved through a medical director at the cheapest possible cost. So listen to me when I tell you, and yes, I'm passionate about this topic because it affects people every day. If you have cancer, there are extra costs other than just the treatment of the cancer. On Medicare Advantage, you got a gaping hole there. We already know that. Even on a Medicare supplement, it's going to cover all your treatment, no matter where you go on a supplement, no matter where in the country that you go. But there are other things like travel costs, staying in a hotel for family members, people coming to take off of work and help you through those chemotherapy sessions. And that's where cancer coverage, cancer insurance can really, really help. So I made a website to make it easy for you to look at what those options are and see if it's appropriate for you. You don't have to sign up during any period of time during the year. You can get these plans that will supplement your Advantage plan, both on the cancer side or the hospital indemnity side, which means those hospital costs that are so expensive now. You can have a tiny little plan that doesn't cost much at all, just in case, so that you can use the insurance company's money for that instead of your money for that. And now is the time of the year that the offices have calmed down from the crazy enrollment period, where we can go back and help people who've joined Medicare Advantage plans to take advantage of the fact that they need to get this coverage to complement their plan. It's a website called CompleteMyPlan.com, because if you're on a Medicare Advantage plan, it ain't complete. You need to complete your plan by getting these additional coverages so that you don't find yourself in a situation where you're deciding between that treatment or food on the table. Or how am I going to reach my max out of pocket, which I never thought I'd really have to use, but now that have a cancer diagnosis, I'm going to hit my max out of pocket, especially if you're diagnosed in the second half of the year, because that max out of pocket on Medicare Advantage rolls over again. And now you have to hit it again for the second time once it goes in the next calendar year. CompleteMyPlan.com. Then you can have the peace of mind knowing that what you have is for the best we can possibly do, a complete package. So check that out. Highly encourage you to do that. The other thing that's been going on is Medicare supplement folks. Yes, they have the freedom to go anywhere that they want to. And yes, that's a nice thing to have. But the medical loss ratios with these insurance companies, have been watching them very carefully, have gone up to the 20 and 30 and 40% range, where they're losing money at the rates that they're taking in premiums right now. The cost of inflation that we've all experienced has not been immune over on the Medicare side too. On the health insurance side, they've been experiencing the same thing, mostly with labor. So what that means is the rates on Medicare supplements have been going up. Now, I've been talking for years about being on the best Medicare supplement plan that can hedge against those guarantee issue people being dumped into the plans. And if you have a choice between Plan F, Plan G, and Plan N, in most all states and most all cases, Plan N is going to be far and away the best, because someone can't be dumped into Plan N based on losing other coverage. Like these 2 million people that lost their Medicare Advantage plan this past season, they could get a guarantee issue Medicare supplement plan, but not Plan N. That's reserved for people brand new to Medicare or who have successfully passed, because they're healthy, the underwriting. And that's the kind of pool of people you want to be associated with, is where they can keep the rates as low as possible. But again, across the board, the losses on Medicare supplements have been great. So what are they doing to bolster that, to stay in business? They're sending out rate increases. All the companies are. And when you get that rate increase notice, there are two things you can do. You can either take it on the chin and just continue to pay it, because a unique a unique benefit of a Medicare supplement plan or Medigap plan is they can never cancel you. No matter how sick you go, no matter where you move to in the country, you can keep your same Medicare supplement plan. And that's great. It's guaranteed renewable as long as you pay the premium. If you can no longer afford the premium, that's why you need to look into alternatives like possibly a Medicare Advantage plan with the strongest advocate you can possibly find, to find one that lines up with your needs the best. That season is over as of right now to go into a Medicare Advantage plan. So if you're getting a rate increase, or you got a rate increase in the last year or any time, and you never shop the market, let me tell you how that looks. What happens if you're going to shop the market? Changing a Medicare supplement plan means we would do an application for you, answer some questions on the phone, submit the application, and then we wait to see what underwriting is going to do with that. And that's why experience matters. If you just have an agent that willy-nilly just asks you the questions, and then you finally realize, oh no, I answered yes to a question that's a black and white question. It's a knockout question. That application should never be submitted. The agent should then pivot and go, there's another company that may cover that. Rheumatoid arthritis, height and weight, diabetes. These are some of the key indications in cancer in your past that if an agent doesn't have the necessary level of experience, they're just going to tell you you don't qualify. So if you went to an agent and you had something like that, and you thought, well, I am pretty darn healthy, I don't know why an insurance company would not take me, you may have been with an agent or going through one that just has a very limited repertoire of plans that they could look at, all the underwriting. That's where experience matters, and having multiple companies to go to. So anyway, if you do get a Medicare supplement or you apply for one, there's no interruption to your current plan. Nothing changes, and don't do anything about canceling it again until you're approved elsewhere. But there are no added pre-existing conditions. That means if you get on a new plan, they're not going to say, well, for the first 6 months, we're not going to cover whatever you've already had treated. That does not happen. As long as you've had continuous coverage of care, there are no such things as pre-existing condition exclusions. A lot of people have pre-existing conditions, but it's not going to be excluded by your new company, only if there's a major gap in coverage and you had no insurance whatsoever. Same thing applies if you're coming from a Medicare Advantage plan now into the world of original Medicare and a Medicare supplement. They're not going to deny coverage based on having had a pre-existing condition, because you've had qualifying coverage with no gap of 60 days or more. So pre-existing conditions are not a concern, and it doesn't hurt you to apply. It doesn't go on your credit score. It doesn't cost you anything if you're not approved at the new company. They're not going to keep your money or anything like that. It doesn't hurt to shop the market, and it could save you thousands. Every week we have cases where our people will share, I just saved this person $3,000 a year, and they've got the same coverage they had before. And I'll say, why didn't they shop it before now? Because usually the savings start out about $60 a month, $100 a month, $150 a month in savings. You just heard the gentleman talk about he's paying $400 for Medicare Advantage plan. He has no freaking agent. No agent in their right mind would put somebody with a plan like that. It's insane. So anyway, have the benefit of going through a broker that doesn't cost you anything to look at the market and maybe things that you just aren't aware of yet. What you don't know could cost you a lot. If you go to our website called SeniorSavingsNetwork.org, it walks through this process. It's very simple, so that you can have, again, a complete package and know that you're paying the best you can possibly pay for your Medicare supplement plan. And remember, you can change Medicare supplements 365 days a year. There is no time period to do it. And outside of the crazy period of the last part of the year, that's the best time to do it. So that would be like now. We could shop that plan for you. If you get approved, great, your rate goes down. Your doctor doesn't care you're paying less. The coverage is exactly the same. You're not going to get into one Medicare supplement where they're going to deny something that your old one used to pay for you. That is impossible. It doesn't happen. Medicare supplement is Medicare supplement. It's the same thing. Same providers are available to you, same hospitals, same freedom to travel the entire country without regard for a network, no prior authorizations, and no referrals required. They're all the same. So why pay more? And why take it on the chin when they're offering you those rate increases? Now onto the news about Medicare. Listen, if you've gotten any benefit whatsoever from this channel or from me over the years, or even just now for the first time, please like this video. Would really appreciate it, and share it with somebody else who's on Medicare. That's how the channel has grown to over millions of views right now and lots of subscribers. Please stay tuned because things change with Medicare all the time. And boy, we've got some things happening. Medicare Advantage provider was called out at the end of 2024 because they were lying about things to get more money from Medicare. Say it ain't so, Joe. Tell me more.
News just into our newsroom in the last couple of hours. The Western New York-based healthcare company Independent Health has agreed to pay almost $100 million to resolve allegations that they purposely broke the law. According to the U.S. Attorney's Office, the insurer allegedly submitted invalid diagnosis codes for Medicare Advantage plan users to increase the payments that Independent Health received from Medicare. Oftentimes, those diagnoses were not supported by a patient's actual medical records.
You're going to be hearing a lot more about that in the news here coming up. There's a new proposal right now that's going to require insurance agents to finally tell the truth. Been talking about this for years, that insurance agents today, the typical Medicare agent, will never tell you that Medicare supplement, that is original Medicare with a Medigap plan on top of it, are even an option when you're turning 65. How do I know? Thousands of seniors have told us the same thing. They were never told until they watched this channel they had another alternative besides Medicare Advantage in the managed care world. They were never told. So now there's a proposal at CMS, that's the Center for Medicare and Medicaid Services, that will require now for the first time, if it passes, if it goes through, it's in a comment period right now, that agents must tell the truth about what the options are. And boy, do I hope this goes through. Here's a summary. The proposed rule highlights the necessity of these broker responsibilities to address the long-standing gaps in beneficiary awareness and understanding of their Medicare options. Yes, that's the truth. Specifically, it acknowledges that some seniors were not informed of their eligibility to enroll in Medigap plans during their initial enrollment period. Some, I would say a vast majority, were never told that they had an option, or were unaware that of the guarantee issue rights that accompany that period. Reasons for the proposed changes? 1, beneficiary confusion. This rule identifies that many seniors do not fully understand the implications of their Medicare enrollment choices, particularly the limitations on when they can enroll in a Medigap plan without medical underwriting. See, from the time you fire off your Part B of Medicare, you've got A and B. When your Part B starts, you start a 6-month window that you can get a Medicare supplement plan with no questions asked. It's actually called your initial election period. It's your one IEP that you get one time. And if you lose that, I had a friend message me over the Christmas holiday and say, hey, my dad's losing his employer coverage and he wants one of those Medigap plans you talk about. My only question was, has he been watching my videos? No. Second question, did he start Part B while he was at his large employer? Yes, he did. He gave up his IEP period, his 6 months with no underwriting required. He gave that up because he started Part B, and he paid for Part B for 5 years, even though he didn't get any benefit from it because his employer plan was primary. He didn't even need Medicare, but he never asked and nobody told him because he never sought professional help with that. The potential risk of switching from a Medicare Advantage plan to traditional Medicare without guaranteed access to Medigap plan later. Yeah, cows will fly when agents start telling the truth on that one. Number 2 reason, missed opportunities. The proposal highlights that some beneficiaries were unaware of their ability to enroll in a Medigap plan during their initial Medicare enrollment period. No kidding. Later faced barriers to obtaining Medigap coverage due to underwriting requirements or a lack of guarantee issue rights. No kidding. And 3, the reason to address misinformation or omissions. Omissions? Brokers have a critical role in ensuring beneficiaries are fully informed. Well, you are if you're watching this channel, about their rights and options, which has not always been effectively communicated in the past. That's a nice way of sanitizing it. Ensuring beneficiaries understand the state-specific rules for Medigap guarantee issue rights aims to reduce the potential for confusion and suboptimal choices. The proposed requirements are framed as necessary to protect beneficiaries from making uninformed decisions during enrollment, and to promote transparency and understanding, especially for low-income beneficiaries or those unfamiliar with the complexities of Medicare. Get professional help. It will benefit you greatly. Good time to revisit, again, the differences between Medicare, original Medicare, that is, and Medicare Advantage, the private one. Listen to this, and just in case you don't know the difference.
With our NBC News investigation into Medicare Advantage, those Medicare-approved plans offered by private companies. Millions use them, but we found they routinely reject claims for necessary care. As Sam Brock reports, it's devastating hospitals in rural America.
Dr. Kenneth Williams is the CEO. He says the hospital can no longer afford the unit, or any inpatient care for that matter.
All of this used to service people that really needed help, and now it's just totally empty.
It's empty, it's gone, and it died the last few years with Medicare Advantage.
Medicare Advantage is a private alternative to traditional Medicare pitched by celebrity spokesmen like Joe Namath.
Medicare Advantage plans have added new benefits.
31 million people are on the plans, which are often cheaper than Medicare supplements and promise better benefits and lower premiums. But the CEOs of rural hospital systems in 6 states tell NBC News that Medicare Advantage routinely denies reimbursements for necessary care.
2006, we went from being well in the black to losing $1.7 million.
Overnight.
Medicare Advantage. Yeah. And all of a sudden, we went from smiling to crying. And nothing changed other than that.
One government report found the top Advantage plans denied payment for nearly 1 in 5 claims that met Medicare rules.
Your fight is not just to take care of patients anymore. Your fight is becoming more to get paid from the insurance company.
And without the resources to push back, rural hospitals like Dr. Williams's are forced to eat the higher costs.
How dire is the situation when it comes to rural hospitals?
More than 300 hospitals that are at immediate risk of closure, and another 300 that could be at risk of closing in the next 6 to 7 years.
When Rose Stone retired, she signed up for a Medicare Advantage plan.
Rose, how long have you been coming to Dr. Williams' clinic for?
20 plus years.
And did you think if you signed up for Medicare Advantage, you'd be able to continue to do that?
At first, I did.
She was later surprised to learn the plan didn't cover her visits. Faced with paying out of pocket, she made a difficult choice.
I had to stop coming to Williams Clinic.
An advocacy group for Advantage plans tells NBC News they acknowledge the challenges facing some health systems, but we need to ensure coverage is maintained for millions of seniors. Rose has since gotten rid of her Advantage plan and is seeing Dr. Williams again.
You felt like you were taken advantage of.
I know I was. Yeah, I know I was.
Sam Brock, NBC News, Holly Springs, Mississippi.
Just want you to remember the differences in Medicare, original Medicare and Medicare Advantage, because they are starkly different. Very, very different. But again, not everyone can afford original Medicare to go with a supplement. And so Medicare Advantage is a necessary evil for them. And that's why you need to have an advocate to find out the one that lines up with what your needs are the best. This is interesting. Kaiser Family Foundation, not to be confused with the Kaiser Health people. This is the independent nonprofit organization, Kaiser Family Foundation Health News, has been suing now CMS to get the audit records of when they've been auditing Medicare Advantage plans. Now, since this story first came out, and I just looked today, the Office of Inspector General has started to trickle out the results of these audits, and it's fascinating. They're getting back, or they're claiming back from Medicare Advantage plans, 3 million here, 4 million there, 5 million, 10 million, 60 million here, because they've been robbing the government blind on the Medicare Advantage plans and denying care, found in other OIG documents. Kaiser Health has sued the U.S. Department of Health and Human Services Office of Inspector General to compel its release on a range of Medicare Advantage plans. Unbelievable. In just a second, we're going to have a discussion here about, and it's fascinating, these very kickback schemes that are behind some of this. The suit, filed November 12, 2024, under the Freedom of Information Act, seeks disclosure. Now, they want to know what Medicare has been finding, because they've been finding a lot in the Office of Inspector General, but they've also been prohibited from CMS from clawing back some of that money that was scammed out, overpayments in the audits. It also seeks records reflecting communication between HHS and CMS officials. Oh, here's the good stuff. Regarding the government's policies for recovering overpayments discovered during the audits, including a controversial decision in January 2023 to limit dollar recoveries for audits dating back a decade or more. Additionally, the suit seeks copies of government contracts awarded to outside firms that have conducted Medicare audits, Medicare Advantage audits, including budgets and performance evaluations dating back to 2020. According to the suit, the IG's office has audited Medicare Advantage programs more than 36 times since 2019, revealing billions of dollars in overpayments. That's your taxpayer money spent on denying care and just going into the profit of the Advantage companies. But government officials have not recouped the overcharges. HHS IG says, quote, as they have left taxpayers footing the bill for billions of dollars in overpayments, even though the OIG's primary purpose is to combat fraud and waste in Medicare. In fact, taxpayers have been forced to pay for the Medicare Advantage program's wasteful spending twice. First, because of the program itself, and second, because of the cost of the audits, which the government spends millions of dollars to conduct. Medicare Advantage, run by private insurance companies, enrolled more than 33 million seniors, more than half the people on Medicare. But the program has faced criticism that it costs billions of dollars more than it should, with research showing that many health plans exaggerate how sick patients are to boost payments. That's what we just saw with independent health. A FOIA, that's Freedom of Information Act, lawsuit filed by KFF in September of 19 prompted CMS to release summaries of Medicare Advantage audits, 90 of them, revealing millions of dollars in overpayments. As part of that settlement, they had to settle, so that's why this one's going to actually go through, I believe. Part of that settlement, CMS also paid $63,000 to Kaiser's legal fees, though it did not admit to wrongdoing. It's just incredible to me. Stick around for the discussion happening in just a minute, where we're going to talk about the kickbacks going on between agents and doctors to get people on Medicare Advantage. Say it ain't so, but it's happening, and now it's been called out by the same Office of Inspector General that's been really stiff-armed by CMS about going after those overpayments. But I want to share with you some of your feedback, some of your comments, things that you're saying to us here. Chris, you're really confusing me. Is this for established customers or future customers? When it came down time to choose between the 5 plans offered to me via Medicare, I was confused, and I only believe I hopefully chose the correct policy for me, but I had no guidance when I chose the plan I picked because it appeared to be the best. But honestly, I love honestly, I don't know. I'm still not sure what my monthly responsibility. My question to you would be, and you're commenting on this channel, with all the grace of God, let me say this in the nicest way possible. Why in the world are you confused? You only believe that you chose the correct policy for you, and you had no guidance when these people right here do that every day at no charge to you. So do a bunch of other thousands of good agents that are out there that will tell you the good, the bad, and the ugly, showing you both sides of the coin. There is no excuse whatsoever, because our cost is zero. No excuse whatsoever to be on your own, to be confused, and hope you got the right policy for you. So, Michael, my advice to you is use this period of time to review what you got. See if it actually lines up. See if those doctors and everything you found on your own, because the directories are mostly wrong. See the video I did on ghost networks that the Senate found out. They're ghosts because they don't really exist. They only exist for the purpose of getting you to enroll. Then once you did enroll, you find out suddenly it's not there for the whole year, and you can't change. Find somebody that you trust, whether it's my office or somebody else, and get their free advice. Call 2 of them until you let somebody do the legwork for you. That's what we're paid for by the insurance industry. Lori said, I thought I did my due diligence. However, I'm regretful because I did not understand the benefits of supplemental coverage over Advantage. So during this enrollment period, I switched Advantage providers. Do I still have a chance to go to the supplement plan during this enrollment period? I may have the notice of cancellation of my 2024 policy. If I do, and although I already enrolled in another Advantage plan, can I get into a supplemental plan now? Again, please call our office. You do have options. Your options are not just limited to what you think you can find on your own and what you get stuck with because of what they'll shove you into. Please call for free help. And let's see this one. If I had been under an Advantage plan for the last few years with all my health conditions, I would be bankrupt by now or dead because of prior authorizations. We must not be forced to have an Advantage plan. I agree. And if you did not see my video on Dr. Oz being the proposed leader of Medicare, Dr. Oz is all about Medicare Advantage. Please go watch that video because we need to get ahead of that really fast. If you move out of the area and go from Advantage to a supplemental plan, and supplemental has to take you with pre-existing conditions, how does it work if you move back to your original address? Can you keep the supplement plan? Yes, as I addressed earlier, once you have a Medicare supplement plan, it's basically like an indemnity plan. It's just going to pay your bills no matter where you live. Just like a life insurance policy. If you take out a life insurance policy, it's going to follow you no matter where you live. It was originally under the rules of the state in which you obtained that policy, but it does follow you. So if you buy a Medicare supplement plan in South Carolina, then you move to Florida, you keep the same plan, same documents, same everything. That's a good thing. What he's talking about here is one of the special enrollment periods to go from a Medicare Advantage plan to a Medicare supplement with no underwriting would be to move out of the service area for your Advantage plan, your managed care plan, because those are finite area restricted plans. Supplements are not. Medicare Advantage is restricted to a network. So if you change your address with Social Security and Medicare and you tell them you've moved now out of that service area, that then generates for you a special enrollment period to get a Medicare supplement plan guarantee issue. The problem is they're going to put you on the most expensive Medicare supplement plan available. If you were eligible for Medicare prior to the year 2020, September 1st to be exact, then your guarantee issue plan that you'll plop into is Plan F, the most expensive plan there is. If you were eligible for Medicare after September 1st, 2020, known as MACRA, your guaranteed issued default plan will drop you into Plan G. That's why I say you should go for Plan N, but you'll have to answer health questions. Why? Because Plan N does not have all the people dumped from other plans, unhealthy as they can be, dumped into those plans, and you're all benefiting from the cost or lack thereof, not a benefit. You're all paying the cost of a lot of sick and older people that have lost those coverages, and they're just dumped into a guarantee issue plan like Plan G. That's why Plan G has higher rate increases across the board, across the country, because they have no choice but to absorb those guarantee issue folks. I have a PPO and it's hard to find any doctors to accept my plan. Doesn't just affect rural. Covered this many times, and I hate it when people say I've covered this many times or I wrote an article about that, whatever. You weren't there, so you didn't see it. The point is, PPO plans do not mean you can go to any doctor. Agents sell them on the basis of, with a PPO, you're not limited to a network, and that's only half the truth. The other half of the truth is, yes, you can go to any doctor as long as they accept the payment rates that they would have for their own contracted doctors. And I would argue, if they were going to do that, they probably would have joined the network in the first place. So it's no surprise to me that you joined a PPO plan, often for paying premium on top of what you would have done for an HMO Medicare Advantage plan, which is generally no cost to you. But you pay more to be on a PPO plan, have higher copays across the board, and a higher max out of pocket than you otherwise would have, only to then suddenly find out that this lure of being able to go anywhere is not actually true. But the agent got an enrollment out of it. You got to be very careful with going through a PPO and just expecting that you're going to be able to go anywhere. It just doesn't happen. Glad to find this. These are just some positive accolades. I want to thank you all for putting these in. Everyone should be part of your educational information. That's true, whether they work with us or not. Finding your company was a huge lifesaver for our family and appreciate what you do. Thank you for being on. I really appreciate those positive comments, y'all. Thanks to you and my sister finding you, I'm on Original Medicare. I still watch this video and learned a lot that I didn't know. You and your team are the most informed anywhere in the U.S. Well, thank you for saying that. Glad I watched your video before I went on Medicare so I could get correct information the first time. Been happy with it. I want to thank you for your hard. And what I see mostly as I read thousands of comments is, I wish I'd found you sooner. I wish I found you sooner. I wish I'd found you sooner because I made a wrong choice. So again, if you know anybody that's on Medicare, because they can make choices, they can have a do-over if they have the right advice and the right person guiding them, or somebody new to Medicare that's going to be going on to Medicare in the next year, please share this information. This is ironic. This is actually shared by a hospital network on their Facebook page. And they say, Medicare Advantage is what this is on the bottom. Remember, this is your brain. This is your brain on drugs with Nancy Reagan. This is original. This is Medicare Advantage. It's what you get. And this, by picture dichotomy, is traditional Medicare with a Medicare supplement and drug plan. You can have your steak and eat it too anywhere in the country. This is a hospital talking about this. And we saw in Lester Holt's report, hospitals are bearing the brunt of the cost cutbacks of what they're being paid by the Medicare Advantage plans. Now, I want to share with you this thing. And it's a little long. So if you're going to tune out, you may. But I want you to hear this discussion. The Office of Inspector General has released a report saying that they're actually going to hopefully do what they say they're going to do, and that is enforce these illegal relationships that have so far been not talked about very much, where agents have a reciprocal relationship where they're being paid by doctors to get people on the doctor's rolls. The agents are paying referral fees as the doctors give the agents people to come onto the Medicare Advantage plans to say, go see that agent. And they're paying a kickback program back and forth. And it violates the anti-kickback statute when it has anything to do with benefits that are regulated by the federal government, of which Medicare actually is. So join me in this discussion as they discuss. These are two people here discussing this. They're not really two people. The difference between agents getting kickbacks and providers, and should they do that? Should they not do that? And I'll show you the actual document from Office of Inspector General right here. And then stick with me to the very end. We'll close out after this.
Be so overwhelming for them.
It really is.
You know, trying to sort through all the options, all the different plans, and all the sales pitches.
Mm-hmm.
I worry about seniors falling prey to, you know, misleading tactics.
Oh, for sure. It's a valid concern. And actually, it's something that the government's taking pretty seriously.
Really?
Yeah, the Office of Inspector General.
Okay.
You know, the OIG.
I've heard of them.
They actually issued a special alert to warn seniors about potential fraud in Medicare Advantage marketing.
So they're basically saying, hey, watch out. There's some bad apples out there.
Exactly. They're shining a light on specific types of payment arrangements that could put seniors at risk.
Okay.
It's not about, you know, saying that every single Medicare Advantage plan is bad or anything like that. But it's really about recognizing those warning signs and protecting yourself.
Okay, so let's dive into those warning signs then. What exactly is the OIG concerned about?
So they're really flagging two main types of shady payments.
Okay.
And I kind of think of them as like two sides of the same coin.
Interesting.
Which is profiting off of patient referrals.
Okay.
So on one side, you have the Medicare Advantage organization.
The MAOs.
Yeah, the MAOs, exactly. And they're offering payments to doctors or their staff for steering patients towards their plans.
So like a doctor's office gets a bonus for every senior they sign up for that specific plan?
Precisely.
Wow.
And then on the flip side, you have doctors who are making payments to agents or brokers for sending patients their way.
Got it.
So imagine like a doctor offering a commission for every Medicare beneficiary that an agent enrolls in their practice.
So it's all about these incentives, but those incentives might not line up with what's best for the patient. Are there like specific examples of these payments that the OIG calls out as being like, hey, this is a problem?
Absolutely.
Yeah.
So they mention things like giving out gift cards to doctors' offices.
Oh, wow.
Or payments that are actually based on the number of patients that are enrolled.
Really?
Yeah. And these are, you know, classic examples of what are considered kickbacks.
Right.
Which are illegal when it comes to federal healthcare programs like Medicare.
That's unsettling.
It is.
It really makes you wonder how widespread this kind of thing is.
Yeah.
But let's get back to the impact on patients.
Sure.
Why are these payments a problem?
Well,
I mean, is a little bonus for a referral really that big of a deal?
You know, it might seem like a small thing at first.
Yeah.
But the consequences can actually be pretty significant.
Really?
Yeah, because these financial incentives can create a system where profits are prioritized over patients.
Oh, that's not good.
No, it's not.
Yeah.
So essentially, decisions about your healthcare might be driven by who's offering the biggest payout, not by what you actually need as an individual.
So instead of getting the best care, you're getting the most profitable care.
Unfortunately, that's a real risk.
Wow.
I mean, imagine you're switched to a plan without even knowing it.
Oh, gosh.
And you lose access to a doctor that you've been seeing and you really trust.
Yeah.
Or you're steered towards a doctor who, you know, they get these bonuses for enrolling patients.
Right.
But they don't actually provide the best care.
That just feels like such a betrayal of trust.
It is.
Especially when you're already dealing with, you know, the complexities of Medicare.
Absolutely. And, you know, on top of that, the OIG also raises concerns about potential discrimination here.
Oh, really?
Yeah. So if a Medicare Advantage organization is incentivized to enroll healthier patients,
right,
well, then they might actually avoid or discourage those with chronic conditions.
That makes sense.
Who are likely to, you know, require more expensive care.
Yeah.
So that's another layer to this.
Wow.
Yeah.
That's a lot to think about.
It is.
It's pretty alarming to think that some folks, you know, might be getting pushed toward certain plans or doctors just because it's financially beneficial for someone else.
Right.
So what can seniors do to protect themselves?
Well,
how can they spot these shady tactics in the wild?
Yeah. Well, the good news is awareness is really key here.
Okay.
The more you know about these tactics, you know, the better equipped you are to avoid them.
Right.
The OIG alert actually highlights some suspect characteristics to watch out for.
Okay, let's hear them. What should set off alarm bells for seniors?
So high-pressure sales tactics are a big one.
Okay.
If an agent is really pushing you to sign up right then and there,
right,
or they're using scare tactics,
right,
or making promises that sound way too good to be true,
yeah,
that's a major red flag.
So if they start throwing in, you know, a free set of steak knives,
exactly,
it's time to walk away.
Yeah, pretty much. Another thing is when offers are tied to specific plans or doctors, a legitimate agent should present you with a range of options and help you choose what's best for you.
Yeah.
Not what's going to earn them the biggest commission.
Right.
You know what I mean?
Yeah, it's so important for seniors to feel empowered to ask questions and not be pressured.
Absolutely.
You know, this is their health care.
It is.
It's not a timeshare.
Exactly.
You know?
Yeah.
So besides being wary of these high pressure tactics
right,
and too good to be true promises, what else can seniors do to navigate this whole Medicare Advantage maze?
Yeah.
It could be so confusing.
It really can. The abundance of choices can make it super overwhelming. And that's why it's just crucial to have reliable, unbiased information.
Okay, so where can people find that kind of support?
Right.
Like who can they trust to guide them through this without pushing a particular agenda?
Well, luckily, there are organizations that are dedicated to helping seniors make informed choices about their health care.
Oh, that's good.
And one such resource is the Senior Savings Network.
Okay.
At seniorssavingsnetwork.org.
It's Senior Savings Network at seniorssavingsnetwork.org.
Yeah.
Tell me more about them.
Yeah.
What makes them stand out?
So they're an independent insurance agency that specializes in Medicare plans.
Gotcha.
But what sets them apart is their commitment to providing personalized guidance without any pressure to buy.
Okay.
So they're really there to help seniors understand their options and find plans that truly meet their needs without any sales pitches.
That's reassuring to hear. It's like having a trusted friend in your corner.
Exactly.
Someone who can help you cut through the confusion and make the best decision for your health and well-being.
Absolutely. It's all about empowering seniors to make informed choices about their health care.
I love that. So if we could just like boil it all down.
Sure.
What are the key takeaways you want our listeners to remember from this deep dive into Medicare Advantage?
Well, first and foremost, just remember that these predatory marketing practices exist and you need to be vigilant.
Yeah.
Don't let anyone pressure you into a decision that you're not comfortable with.
Right.
Take your time, ask questions, get everything in writing.
It's your healthcare, your choice.
Yes.
Don't be afraid to advocate for yourself.
Exactly. And remember, you don't have to navigate this alone.
That's so important.
There are resources like the Senior Savings Network that can provide that unbiased support and guidance.
It's so important to spread the word about these issues too.
Absolutely.
You know, share this information with your friends, family members, anyone you know who might be vulnerable to these tactics.
Yes. The more people who are aware, the harder it will be for these schemes to succeed.
Sorry, agents and doctors have been playing little games of money back and forth to lure people in. And I've actually sent in doctors' offices recommending that people go to one particular broker. Whether they're paying kickbacks for that or not, I don't know. It's just very important that most people find out. One day it'll hopefully be the law that they must, that there are two differences. There are two choices. Original Medicare, which you earned. It's not a subsidy. It's not a handout. It is something that you paid for your entire working life, and you deserve it. And if you can afford Original Medicare with all the freedoms that it has, this is from the Medicare and You Guidebook, by the way. This is not a Chris Westphal document. This is from Medicare. And this is Original Medicare is your choice, or you could give up your Original Medicare for the time that you are on a Medicare Advantage plan. You are on one or the other. You can't be on both. But if you're on Original Medicare, I highly recommend getting a Medicare supplement plan, because there's no limit on the out-of-pocket exposure to the additional cost that it has. It does have gaps in it, and there's no limit. So the other side of the coin is, if you are on a Medicare Advantage plan, or that's the only option that you have, please look into cancer insurance and a hospital copay plan. And you can find those at CompleteMyPlan.com. CompleteMyPlan.com. Now is the best time of the year for that. If you go to our website, there's a big green button that says, click here for Medicare Help. Has all the scenarios and the explanation of what you need to do if you're going to go in those different areas. My name is Christopher Westphal. I've started this journey a long, long time ago and have helped lots of people across the country. We're licensed from state to state, from coast to coast, and in all the states. Yes, now we're in all the states. So if we can help you, please reach out. We would be honored to do so. Our phone number is right there, but if you can book an appointment on the website, it's way easy to do that. Please just don't miss the appointment time, because it completely is blocked off just for you, and you can do it entirely online. And we'll put you right where you're supposed to be with the appointment situation on the main website. Just look for the Medicare Help side. Thank you for being here. God bless you. And we'll have more news, things happening and developing with Medicare. Some good things happening for the new year. Thanks for being here.